Hello everybody, this is Ghisa from University of Padova. Today we are going to talk about the endoscopic features of eosinophilic esophagitis. As we know, EOE is a chronic disorder characterized by symptoms related to esophageal dysfunction and eosinophilic predominant inflammation. This inflammation could determine endoscopic injuries and, over the time, lead to a fibrotic remodeling of the esophagus. In 2013, Hirano and colleagues proposed and validated a standardized classification to describe typical endoscopic features of EOE, the EREF score. Rings, furrows, edema, exudates, and strictures showed good inter-observer agreement. About edema, it is a direct consequence of active inflammation. On the left, you can see EOE patients in remission that show normal mucosa with distinct vascular pattern. On the right, due to the inflammation, vessels are less clearly visible and could completely disappear. Even the mucosa appear thicker. Rings are circumferential ridges seen after insufflation. You can find mild circumferential ridges, as on the left of the screen, distinct rings that reduce the diameter of the esophageal lumen in the middle, and tight rings that do not allow the passage of the endoscope, as you can see on the right. Exudates, visible as white spots, are the consequence of eosinophilic microabscess. The degree is established considering if they occupy more or less than 10% of esophageal surface, as you can observe on the left and on the right. In this slide, you can see the longitudinal furrows. They are vertical lines that could be superficial signs or clear deep indentation of the mucosa, seen after insufflation. The last element of EREF score is the presence of esophageal strictures. Even if associated with the severity of dysphagia, stenosis are not specific of EOE. An adjunctive typical aspect is the so-called Crêpe-paper mucosa, that refers to mucosal fragility or laceration after the passage of diagnostic endoscope. It can be attributed to the loss of mucosal elasticity due to the chronic inflammation. In conclusion, even if not necessary as criteria for the diagnosis of EOE, these endoscopic changes are useful as evidence of the disease and could help in the assessment of response to therapy. Edema, exudates, and furrows should be considered as a sign of active inflammation. Instead, rings and stenosis suggest fibrotic remodeling of the esophageal wall.